used to be, not too long ago, that, granddad is just getting senile, and that's the way it is. But we began to realize, no, that's really a disease entity that we can define as something we can attack, and eventually it became known as Alzheimer's disease.
Dr. Stephen Youngkin, Dr. Neil Graff Radford, and their Mayo colleagues have developed a blood test that they believe identifies some of the risk of developing this devastating disease.
This blood level reflects some of the risk of who's going to get the disease and when it's going to happen. And it's before the people have the disease. And that's the crucial point, because everybody who works in Alzheimer's disease now, our dream is not only to help patients, but to prevent the disease.
A protein called amyloid beta 42, or A beta 42, accumulates in the brains of people with Alzheimer's disease. Dr. Youngkin and others discovered the same protein was present in blood and cerebrospinal fluid. It seemed possible then that scientists might be able to predict who's at risk for developing Alzheimer's by measuring the level of this protein in the blood. It wasn't that straightforward.
We had a really good reason why a high level of the A beta 42 would be a good predictive factor, and luckily we were compulsive enough to do all the tests instead of just stick to one, then the ratio became obvious.
The team discovered that as A beta 42 is deposited in the brain, the level falls in blood and cerebrospinal fluid. The more common form of amyloid beta, the 40 amino acid form, A beta 40, remains relatively constant in the blood over the same time. When comparing the two protein levels, the Mayo team discovered that people with the lowest ratio of A beta 42 to A beta 40 were 4 times more likely to develop Alzheimer's than those with the highest ratio. They are trying to get further validation for their test by studying an additional 3,000 patients.
The promise here is quite large, because we could have in hand a test like the cholesterol test for cardiovascular disease. And we think that in the same way that you look at the LDL to HDL ratio to determine whether someone's apt to get heart disease, you may be able to look at the A beta 42 to 40 ratio to determine whether they're going to get Alzheimer's disease, then institute therapy early as those therapies come online.